Root canals are dental procedure required when the inner pulp of the tooth is infected or damaged. The procedure involves taking out the affected and damaged tooth, cleansing and disinfecting the interior of the tooth, and after that, filling it and sealing the tooth to stop further infections. One of the biggest concerns people ask about root canals is, what is the cost? The price of a root canal may differ based on a variety of variables, such as the area of the tooth and the extent of the tooth's infection, as well as the dentist who performs the procedure. The cost of a root canal could vary from $500 to $1,000 for each tooth. Many factors could affect the price of the root canal. The most important factor is the position that the tooth is located. The teeth in upper portion of your mouth are typically more accessible and easier to treat, which is why the root canals of front teeth tend to be cheaper than those for the back teeth. In addition, the severity of the condition can affect the price of the root canal. If the condition is serious and requires more intensive treatment, the price of the root canal could be more expensive. A third factor that could influence the price of a root canal could be the dentist who performs the procedure. Certain dentists charge higher for root canals than other dentists due to their experience and knowledge. It's important to investigate the various dentists within your region and then compare costs before selecting a dentist for the root canal. Alongside the expense of the root canal, there could be other charges associated with the procedure. Some dentists might charge for x-rays and other tests for diagnosis that will be required to assess the severity of the infection. Additionally, there could be charges for prescriptions or follow-up appointments following the root canal has been completed. It's important to remember that some dental insurance policies cover at least a small portion of the expense of the root canal. If you are covered by dental insurance, make certain to inquire with the insurance company to determine the extent of coverage as well as what the out-of-pocket costs could be. Some dentists also offer financial plans or payment plans to make the expense of root canals more affordable. The cost of a root canal may differ based on a variety of variables, such as the area of the tooth and the extent of the tooth's infection, as well as the dentist who performs the procedure. The cost of a root canal could vary from $500 to $1,000 for each tooth. It is essential to investigate the various dentists available in your region and consult your insurance company for the possibility of financing or payment plans that can make the expense of a root canal affordable. Be aware that the root canal is usually required to save the tooth from any further infections, therefore it's important to not delay treatment because of worries about the cost.